Welcome to The Aesthetic Angle, presented by Monarch Plastic Surgery, soon to be the #1 podcast in Kansas City for all... You know what? We were talking about this before the show. Why does it have to stop at Kansas City?
I think we can keep going.
Yeah.
Think big.
Soon to be the #1 podcast in the Midwest for... Well, why does it have to be?
In all of the United States of America, Dr. Spaniol.
All of the United States of America for all things related to plastic surgery, injectables, and skincare. Today, I'm your host, Dr. Joe Spaniol, and I'm joined today with my colleague and friend, Dr. Kalila Steen.
Thank you for having me.
Thank you for coming. I'm very excited to welcome to the podcast my patient and friend, Brittany, who is 5 months out from her own Mommy Makeover surgery. She is going to help us dive into the details of Mommy Makeover surgery, what it is, how to choose safely, and what recovery really looks like. Brittany brings a unique dual perspective because she is a nurse at the surgery center where she had surgery. So she's used to working with us surgeons on a day-to-day basis, and she elected to come to one of us here at Monarch for her surgery. So we were very complimented for that. And so she knows things on both sides of the drape and can give us some tips for how to recover from the procedures. And this conversation is a personal experience and general information, not medical advice. So always consult a board-certified plastic surgeon if you are considering this for your own care. Let's get into it. Brittany, what does a Mommy Makeover mean to you?
I would say a Mommy Makeover for me had to do mostly with my belly area. And then also I threw in my breast because I didn't like the way they had looked after having my son. So I decided to go with a tummy tuck and breast lift with implants.
There we go.
Excellent choice.
Dr. Steen, what does it mean to you?
Oh, that's an excellent question. What does a Mommy Makeover mean? I really think that it can mean a whole host of different options to different people. Mm-hmm. I think that broadly speaking, a Mommy Makeover is some sort of breast procedure and some sort of abdominal procedure. And that really has a whole wide of options underneath that. So for breast, we could be thinking about a breast lift alone, a breast reduction, breast augmentation, a breast lift with implants, or even fat grafting to the breast. And then when it comes to the abdomen, we could be doing just a little bit of liposuction. We could be doing a mini tummy tuck, extended tummy tucks, circumferential tummy tucks, even buttock fat grafting on top of that too. Maybe a little bit of a veli to do a little bit of cellulite for the bottom too. And so it starts to drift a little bit. It gets to be a little bit of a wide net, so to speak. So there are many, many options when it comes to a Mommy Makeover. And the most important thing really is to individualize it to your wants and expectations and your goals.
Yes. So I looked up when the term Mommy Makeover came around, and it was in the early 2000s. And it was kind of came out of the media. It was not put together by any, group of plastic surgeons or anything. It's not an official term within our field. It's, to your point, a generic sort of catch-all for something to rejuvenate the breasts and typically the tummy after things like childbearing. But it can often apply, the same procedures can be after, massive weight loss. Brittany, why do you think, what made you want to move forward with it? What made you start sort of talking to surgeons about it?
I was super unhappy with the way that my breast mainly looked. I work out a lot in the gym, so wearing a sports bra is my typical go-to outfit in the gym. And me not having anything to fill it out was super kind of almost like I wasn't feminine enough to wear them. So that's why I decided to get boobs. That was my #1 thing. And then I also just had saggy skin and just didn't like the way that my belly looked. So I went ahead and
you're very fit. You go to you go to the gym several days a week.
Like 4 or 5 times. So yeah.
And you've also been spotted in the corner of an OR during times when there's not a lot going on, doing squats or wall sits. Am I right?
Absolutely. Yep.
Have you seen her do that in your OR?
I think I'm too busy working to have noticed that, Dr. Spaniol.
You see a figure doing squats in the corner sometimes when you're closing. Oh, that's Brittany over there. Just, yeah. So how was the consultation process for you, Brittany? What'd you look for in a surgeon? I mean, you work with us at Monarch, but that doesn't mean you had to come to any of us.
Right. I went to a surgeon before you all, and I didn't like the way that went. It was important for me to have like a board certified plastic surgeon, and then also like getting to know them because it's all about comfortability. And then your nurse, Kimber, also is very sweet and very knowledgeable. She made me very comfortable. You asked if I had any questions. I asked all the questions. So it was really great.
Yeah. I think probably half our Google reviews, at least for me and Dr. Steen, that our nurses are mentioned.
Yes.
Oh, yes.
They're wonderful.
There's no doubt that our nurses are a massive contributor to our patient happiness and patient satisfaction. And they're just so excellent at their job. They've got a huge breadth of knowledge, a huge breadth of experience, very collegial. They work very well together as a team. And we're very lucky, very, very lucky at Monarch to have such a wonderful group of women working with us.
And I think Kimber's been at Monarch for about 18 years. And she trained a lot of the nurses too. So wealth of knowledge and experience there. Yes, we are very blessed. Dr. Steen, so breast rejuvenation procedures often is at least an augmentation. Well, maybe an augmentation, maybe not. Maybe a lift, maybe not. How do you kind of tease that out when you meet with a patient who's considering mommy makeover surgery?
Well, that's a really great question. And I think the first question that I like to ask patients really is, what are they hoping for? And I have people take a look in the mirror with me and talk about what they're hoping to achieve. And sometimes people kind of use their words. Sometimes they kind of use their hands. Sometimes people show me pictures. And all of that is very useful to get an idea of what exactly their goals are for surgery. And sometimes people, the first thing they're talking about is size. Sometimes the first thing they're talking about is shape or where their nipple position is. And so that's a really good indicator to get an idea of what is your top priority, because whenever we're talking about plastic surgery, it's always a trade-off for something. And so to have an idea of what their top priorities are is a really good starting place for me to help guide them to what type of procedures they might be interested in.
Sure. Yeah, 100%. I've seen some patients who were told they had to have a breast lift and they really didn't want the scars. And they're like, I understand my nipples are low, but I really just want more volume. And you counsel them that their nipples are not going to change with an augmentation, and they understand what they're signing up for. You just do an augmentation and they're happy.
I'm totally with you on that.
What they say, but they may have met with one or two or three other plastic surgeons. No, you have to have a lift. Well, it's like, yes, there's the textbook answer, but there's also the answer for the patient sitting in front of you.
I totally agree with you, Dr. Spaniol. I say I have that exact same conversation with patients routinely. And I think it's really important not to have, your own idea of what you think someone needs, but rather to listen to them and to give people different options and to listen to their feedback and to help guide them to their right outcome.
Sure.
What do you use, Dr. Spaniol, to help you guide what procedure to choose for patients?
So I start with their goals. One of the key questions for me is, do they like their nipple position? What's their cup size? What do they want to be? And then that kind of helps me determine sort of which way we're going. Are we thinking a lift? Are we thinking implants alone, or a lift with implants? The most common patient I see for mommy makeover thinks they just need a lift, but they really do want some upper pull fullness. And I'd have to think back about our conversation, Brittany, but I think you knew you wanted some volume, right?
Yes, I did. I knew that if we would just put an implant in, that the implants would be where my breasts were sitting. So I knew that I would have to have a lift to add the volume up here.
Yeah, have the implants add the volume with the lift. Yes, exactly. And a lift alone is not going to add much upper pull fullness. So even adding a modest implant can really help sort of round things out and improve the overall cosmesis of the result.
And so, Brittany, what was that process like for you, choosing what kind of implant, what size implant that you were hoping to achieve? Tell me what was going through your mind through that process.
So I knew I wanted something really subtle and not just like stopping headlights or anything in the streets. I knew I wanted it under the muscle just because I liked the way they looked better. And then so we went through the sizes in the office with Kimber, and she then showed me the...
And what was that process like to pick them in the office?
The 3D software system?
Yeah, what is that?
Chrysalix?
Yes. So we did Chrysalix, which showed me at different sizes that we had chose between like 3 or 4. So she sent me those. It looked realistic, so it showed me what everything would look like.
Can you talk a little bit more about what the Chrysalix, how that helped you choose?
So it showed me views and angles from all around, and you could see you walking also, which was really neat. And then, so I basically went with what I thought I would look like coming from that.
And so it kind of simulated what your before and after
Yes,
might look like?
100%.
And how accurate do you think it was after the fact, do you think?
It was very accurate.
Is that right?
Very spot on.
That's
a
fun.
huge breakthrough to have that, because trying them on underneath the sports bra is very different than seeing it. So
That's an awesome tool.
yeah,
It is great. I think with most patients who do use this crystal excising and with our nurse's guidance, they usually dial in on an implant size very well.
Mm-hmm.
And then the day of surgery, I'm just a technician. I'm not bringing in different sizes and trying to guess, you know. I'd rather just focus on doing the procedure really well.
Mm-hmm. Yeah, I think that's one thing that's important to note is that we think it's really important, or at least I think it's really important, and it sounds like Dr. Spaniol does too, that patients really choose their own implant. Every now and then I have patients who, that's really very sweet, really want me to choose an implant for them. But I, God forbid I choose someone's implant and they feel badly. I would say that not uncommonly, maybe you have this experience as well. I see patients who are coming in for some sort of revision from a previous breast surgery that they've had, and they insist that they wanted some different size implant, but 20 years ago someone just shoved in a breast implant that they never really chose. And, so God forbid, I'd hate to hear that someone thought that about us one day, talk about lack of patient autonomy. And so it's very important to us that people take full control and full responsibility of their implant. And I do think that, I can't think of any patient actually who has been unhappy. I'm sure it'll happen one day, but I can't think of any patient who's been unhappy with an implant that they've chosen themselves.
right.
I've had a few regret their size, but it's usually they're not unhappy. They're like, I wish I would have, usually it's gone a little bigger. And it's not a lot bigger.
A touch bigger.
Yeah.
It's always the ones who don't have them who want more.
True. For preoperative sort of optimization, Dr. Steen, are there any sort of check boxes you want to see for certain patient populations to make sure that they're safe for surgery?
Well, for sure. Well, I think it's very important to say that safety is absolutely our number one priority. We're not doing surgery unless we have optimized you entirely for surgery, because there couldn't be anything more important than safety, especially for an elective surgery. So we're taking a full history and physical prior to make sure that you are healthy enough. And some key things that we're looking at, we definitely want to make sure that your diabetes, if you have any diabetes, is well controlled. We're going to be checking for lab work for that. We're going to be making sure that we're not smoking or using nicotine products or vaping products. Those types of things those are common ones that we're really looking out for to make sure that people are healthy. And of course, if you have any other significant underlying health conditions, we're going to work with your other physicians as well to help make sure that you're healthy enough for surgery.
Of course. And Brittany, you mentioned you wanted your implants below the muscle. Can you talk a bit on that?
I work out in the gym a lot, and I see a lot of bodybuilders, and I know that they get them above the muscle because that's what they want them to look like. But I wanted a more subtle look, and you explained it to me. It might look more realistic or more
natural,
not plastic.
Okay.
But then, I mean, we're all here for plastic surgery, so it's not.
Yeah, neither's wrong. Yeah. So I'll go either way. I started my training going under the muscle, and then once I started in practice here, Dr. Steen and the surgeons started making me think about going on top of the muscle or within the muscle envelope, which I think is Dr. Steen's preferred plane for implants, correct?
I like both approaches.
Yeah.
I think that if I had to pick one that I probably do a little bit more commonly, or that I end up having a conversation with patients and patients end up choosing more commonly, is to go above the muscle with patients. But they're both excellent choices.
Yeah.
You can't go wrong either way.
Yeah, I think there's pros and cons to both, and I really appreciate it when patients have done some homework and they did some reading like you did, and they know what they want in that, because it can be a very lengthy conversation to try to help tease that out with patients. But to review for listeners, there's typically 3 implant planes. You can go fully below the muscle. You can go above the muscle, but within the envelope. That's called subfascial. And then you can go fully on top of the muscle and the envelope, subglandular. And there's great things about each plane. We could get into in a whole different discussion, but bottom line, as long as you as the patient understand and your plastic surgeon's on board with your goals, then they should be able to do you right. Let's move on to the belly button, your abdominoplasty. So you didn't like your extra skin of your lower abdomen, and is that something that had always bothered you since having your son?
Always.
Okay.
I never wore like a two-piece swimsuit just because it showed. I never would wear like certain clothing, like dresses or anything like that sort, because you could kind of see it.
Yeah. We hear that a lot. Which were you more excited about, the breast surgery or about the tummy tuck surgery?
Ooh, that's hard. I think at first I was more excited for the breast, but now I am obsessed with my belly. Like, I couldn't have pictured it any better.
Glad to hear it. Which one do you think your patients stay most often? Are they more excited about postoperatively?
Oh, I really think it just depends on the patient and where they've come from and where their starting point is.
Yeah.
And so it is different for every patient, I would say.
Let's see here. Brittany, how did you manage your time off? So after this surgery, recovery is like the number 2 question often after like picking implants, I feel like, when you're talking to patients.
Yeah.
Of course, with after costs. Those are like the big 3.
So I was super nervous about like recovery time.
Yeah.
I initially took off 2 weeks. I came back to work 10 days after.
Because you were lonely?
Bold choice.
You missed your friends at work?
Yes, I actually visited them every time I came to see you post-op. So I had a good recovery, I feel like. I feel like I was up out of the chair doing my small little walks, what I was allowed to do.
Yeah.
And then I just took it easy for the rest of the time.
What were some things that added to your recovery or made it smoother? If you can think of any hacks.
100% get a recliner. If you can't, make sure that you're just sitting straight up on pillows, basically. Okay. I didn't have any issues with sleeping.
That's amazing.
And then a shower chair will be your best friend.
Oh, it's smart. That's a piece of advice.
I've also heard from patients, if you have an elevated bed, to have a stool, so it's easier to climb in and out of bed.
Yes, so you do not miss the bed or fall out. No.
And you got a nerve block,
I
right?
did.
For your chest and belly.
Mm-hmm.
Do you feel like that was worth it?
Absolutely.
Yeah, so we use a long-acting nerve blocking medicine called Exbril, which lasts for about 48 to 72 hours. Some surgeons administer the medication themselves. Some have the anesthesia team administer a nerve block under ultrasound. It's kind of surgeon preference, but it's definitely a nice investment for patients that get the nerve block. What do you think, Dr.
Oh, yeah,
Steen?
definitely a game changer. Yeah, before that, using pain pumps, this is so much nicer than using a pain pump.
Yeah. And another nice silver lining is that patients don't need as much narcotics during the case often because the pain control starts kicking in. So then in recovery, because they've received fewer opioids, they have less post-op nausea and vomiting. So many of the patients that get nerve blocks, they kind of wake up, they eat some Cheez-Its, and they go home. Like, it's not very... It's pretty smooth, pretty boring, actually, which is great.
It is good.
We love it.
Yeah, because you work in the OR, so you're bringing patients out, and it's never fun to bring a patient out to recovery who's writhing in pain.
I know.
Do you think that this experience has changed the way you view the operating room or vice versa?
Oh, 100%. Because before this, I didn't know, how they go home and, handle things. So now I have a perspective of my own and of how, they're doing at home.
That's lovely. So for the abdominoplasty or the tummy tuck portion of the procedure, can you review the key components of that, Dr. Steen?
Oh, an abdominoplasty has several components. And so first you would start with liposuction, and sometimes that would be an adjunct such as back liposuction as well. And then we move to things like tummy liposuction. And then we lift the flap. We make an incision that goes from hip to hip, and we lift the flap. And then we take a look at the belly muscles. And anyone who's had babies typically has a splay between their belly muscles, and that can cause weakness in their core and kind of a rounded shape to the belly, I guess you could say. And so we sew those belly muscles back together, helps give a nice cinched in waist, give a nice flat belly, can help restore some core strength as well too. That's a really essential portion of the procedure. And then after that, then we go ahead and we remove the excess skin, and we recreate the belly button then at that time as well, and shape the abdomen.
Yeah, and the rectus sheath plication can help with urinary incontinence too. It can restabilize the core and help with pelvic floor issues, which is a really nice bonus for a lot of women who've had children. And sometimes we can overcorrect it as well. I tend to overcorrect the diastasis or the splay, as you called it, and tend to bring in the waistline a little bit more, which patients really like. And then, yeah, it's a great component of the procedure. Would you, if a woman had not had children, let's say that they had just lost some weight, but they were a good candidate for a tummy tuck from a skin and soft tissue standpoint, but they didn't have a diastasis on exam, would you plicate them?
I take a look at them in the operating room, and I take a look at their abdominal muscles and make a judgment call at that time.
Okay.
What is your practice?
I don't know. I saw a patient last week, and she had lost about 50 pounds, so she definitely could benefit from a tummy tuck, but her midline was about a centimeter and a half, so really no diastasis there. But, I do like to overcorrect and bring in that waistline, which I don't feel like there's really much of a downside to. But I'm kind of polling my colleagues to see what they would do.
Yeah.
We want to be snatched.
That's what the poll's going to say.
Yes.
Yeah. So the background towards the more aggressive plication that I do is my close friend and colleague, Sammy Golpanian, is a plastic surgeon in Beverly Hills. He was putting some results up on Instagram that were more snatched than I feel like we were trained to do. And I was like, Sammy, what are you doing here? And he told me how much he was plicating and that patients were tolerating it and it was safe. They were doing great. And so I started trying it on patients and they love it. And there's been articles out since that how it's safe and well tolerated and patients like it too. So anyway, that's fun. So we started naming it the Beverly Hills plication, or the BHP for short.
Great name.
BHP, yeah. Brittany, what was some of the hardest times during recovery, if you can remember? If you haven't blocked it all out.
No, I didn't. I can't. So you have to walk like hunched over for about a week. And honestly, I mean, in my head, I'm like, there's no way I can do that. No, there's no standing up straight because, I mean, you're tight. So walking hunched over was the hardest part because then after I could stand up straight, my back hurt like crazy just because it's not a normal, it's not a normal position for you to walk hunched over for a whole week.
No.
So then that was probably the hardest of it all.
Okay. But then at 1 week, I think Dr. Steen, you have patients lay on a clean, comfortable carpet, right?
Yeah,
Belly, take some deep breaths.
Yeah, I do 2 weeks. At 2 weeks, I have people lay belly down on a couch or a bed, something soft, and start to slowly stretch out. And then I let people sleep as they
can start that at...
I ask people to do that at 2 weeks.
At 2 weeks, okay. So they're hunched over a little longer. Yeah. But yeah, so I've started telling my patients that little trick too. Start like taking deep breaths, realigning their core.
Nice.
But I do think around the 1 week point, people start to really turn the corner.
Yes, I would totally agree.
Yeah. And that's true, especially if surgeons have left a drain, which I don't think you leave drains, right?
Very rarely, yeah. Probably 99% of patients I find don't need drains in my practice.
Yeah, I agree. And for surgeons that do leave drains, they usually come out around the 1 week point. So it's another sort of thing that adds to them turning the corner because that pesky drain is out. They feel like they can move a little better.
Did you have drains during your procedure, Brittany? Or
no.
How was that? How was that to be a drain-free procedure?
I loved it because I was kind of hesitant about having to drain it all. I mean, even though I could, but just the thought of them being inside of my body kind of freaked me out.
Yeah, and that coming from a nurse at that too.
Yeah.
Yeah.
Was a drain or no drain something that you thought about when you were consulting with surgeons?
Yes.
It was. Okay.
I did not want a drain.
Okay.
And I think I expressed that a lot.
Yeah. So that would have been a deal breaker for you?
Not necessarily.
Okay.
Because, I mean, I do see...
There's no right or wrong answer.
I do see the purpose of them.
Yeah.
Now after having the surgery.
Yeah.
So.
Yeah. Okay, let's talk about garments. So... what did you wear for garments? How did that go? Can you talk us through that process? I feel like patients will want to hear that.
I wore the garment that was given to me the day of surgery, which was just like an abdominal binder. Your nurse sent me a huge list of things to get before the procedure, and obviously it wasn't necessary, but you guys like to transition over at a certain time. So then I transitioned into one that kind of fit over my legs and strapped over my shoulders. So then I wore that for, I believe, a month.
Yeah. We typically, well, it kind of can range by patient,
Yeah.
but usually
Remember?
garments most of the time for 2 weeks, and then
Yes.
when they're up and about until 6 weeks. But that can vary by surgeon. What's your preference, Dr. Steen?
Yeah, I have the foam and binder for 2 weeks and then a garment for 6 weeks afterwards.
Yeah, got it. Many patients will wear them longer than that too, just because they feel better, particularly if they're up and about, certain activities.
I totally agree. Yeah, sometimes it's nice to have it for just a touch longer because when people start to go back to more activity too, they start to notice more swelling, even like on one side more so than the other. And so I think it's just a nice little reminder to be like, oh, if you put the garment on, it helps with some of the swelling that you might be noticing. So it's a nice little reminder for patients, I find.
Yes, 100%. Another good thing that can help with swelling and recovery is lymphatic massage. Did you go to some of those, Brittany?
I did, yes.
Do you remember about how often you went? Or?
I went, she kind of steered me in the direction because everybody's different, obviously.
Yeah.
So I went, I believe it was like 4 days after my procedure, and she was super nice. It wasn't like a strenuous massage. So then after that, I went every week. And then for a while, I was going 2 times a week because I was swollen. And then after that, I only went every other week. So she kind of just guided me through that, and everybody's different.
Perfect. Yeah, exactly. You feel like it was worth your time and money, though?
Yes.
Yeah. That's what all the patients that go to lymphatic massage tell me. I mean, what's been your experience, Dr. Steen?
Yes, the patients that I've had go to the lymphatic massage really, really enjoy it. I know it's unfortunately just not something that's in the cards for some patients. I wouldn't sit there and tell someone that it's necessarily 100% necessary. But I think if it's something that's in the cards for you, I think it's a really nice adjunct to have.
I agree. It really gets you over that curve of post-op swelling and stuff. And a lot of surgeons will say that it helps decrease fibrosis too after liposuction, which if you can do that, you get a better result. I mean, so it's kind of a small nuisance, and yes, it's more of an investment, but definitely worth it for a lot of people.
How long after surgery did you say you started going?
Like 4 days.
That's awesome.
And it was actually, I mean, it felt really good. Like I needed it.
That's what a lot of people say. Glad to hear it. Did you have any sort of post-op blues or issues as you noticed your body changing or anything? These are some big changes we're talking about.
I did. At one point, I was like, there's no way this swelling is going to go down. Like, it is truly a trust the process type of situation, because I was like, I can't, like...
I think I even heard some of that murmuring in the halls of the operating room from time to time.
Asking all you guys, hey, when will this go down? Will you look at this? I was like, it's like you're so anxious because you had a surgery, and you see all these results that you guys are showing and like on your pages, and then I'm just like, I want to get there. Yeah, I just have to let time take its course. So
it is important to be patient. You know, people who rush their results, who rush back to activity, you know, can regret it. They can end up with little wounds. They can end up with some really persistent swelling. And so it's definitely important to make sure you take the time, recover well. And I'm sure you're happy you took the time, hey?
Oh, I'm very happy I did.
Good.
But you were back working as an OR nurse around 2 weeks?
So they let me come back. I wasn't doing my normal OR job. I would go back and help, but I wouldn't be back there for hours on end. You weren't moving patients and stuff
at that point. Yeah. So I think that's a good thing to highlight, is most women who work on their feet could be back around 2 weeks with some modification. You're not going to feel 100%, but you're still going to be sore. You're not going to be moving quite as quickly. And so it's good to I try to coach patients on that. Like, you're not going to be back, you know, kicking butt 100% at 2 weeks.
But we were very slow.
When did you go back to moving patients and doing more heavy lifting?
My goodness, I can't. I want to say it was like 4 weeks. And I mean, I was scared, honestly, because I'm like, I don't want anything to like rip or tear or feel weird, because like when I was lifting just random things around, I could feel like tugging, not like a pain, but just like I could feel. So I was just like, I'm not going to do that.
That's good to listen to your body.
It is.
It's important.
That's the best advice.
Yeah. Yeah, exactly. So we did a lot all at once, and some surgeons are hesitant to do, a breast lift with implants at the same time, plus a tummy tuck with liposuction. Sometimes you introduce some, factors that may influence healing in certain ways that can affect the outcome. Have you felt like there's been anything that didn't heal quite right, or anything that we may need to touch up?
No, as far as like my incision and everything, they form like these little dog ears, which we've already addressed.
Yes.
And we're going to be taking those off.
Yeah.
It's nothing that's like super like noticeable or anything. I mean, you are kind enough to take them off.
Oh, of course.
Just because it can help achieve more, but other than that,
I find I get asked about dog ears in consults a lot. Do you find you get asked about dog ears a fair amount?
I mean, I don't know. About as often as I would expect.
Is that right?
Yeah.
Now, how are you guys going to go about removing the dog ears? Is it going to be in the office? Is it going to be in the operating room?
It's just going to be in the office under local.
And we're super nervous.
Okay. If you want a Valium,
somebody to hold my hand.
If you want a Valium, then you can have a Valium.
Yeah, it's great. I mean, I think that's very much so the case that a lot of dog ears can just be handled underneath local anesthesia. It's kind of a lot like taking off a mole, really. It's not so dissimilar from that. I do hear a lot of anxiety in general from patients about the possibility of having dog ears, or what are we going to do if we have a dog ear. But really, it's like 20 minutes, kind of like taking off a mole and going back to regular life. And so we'll have to have you back after you have your little dog ears taken off.
Do an episode on dog ears.
Yeah.
Oh, gosh.
Standing cutaneous deformities.
Yeah.
As they're known in the plastic surgery textbooks. So that's something to point out, that sometimes when you do so much, there's a chance that we need to sort of touch something up, which is kind of expected. It's not uncommon. We'll do right by you. Speaking of those sort of things, patients who've like lost a lot of weight, when you're talking about maybe doing an arm lift or a thigh lift, tummy, breasts, I know Dr. Steen, you do a lot of body contouring after massive weight loss, and sometimes you can go back and sort of touch up one area, right, when you're going to the next, which is something I discuss with patients too.
Yes, yeah, especially after people have had massive weight loss. All the stretch marks that people have, that means that skin is permanently damaged. And so that means that even though you can have a perfectly taut result after surgery and for months after surgery, down the road, you might have a little bit of laxity that comes back up because that skin that's left is still just a little unhealthy. And so every now and then you have to go back and do a little nip and tuck, just some small things to help make sure that those results are as best maintained as possible. But in the scheme of things, the great thing about these procedures is that once you've done them, like you talked about for your tummy, for instance, it's basically a one and done procedure. And that's going to last you the rest of your life, which is phenomenal.
What sort of things should patients look for, Brittany, when they're looking at a surgeon and a facility to have surgery at?
I don't know.
Well, you sort of had that figured out because you worked at one. Okay, Dr. Steen. You worked at a great accredited facility with board-certified surgeons.
Yeah, I kind of said that, though.
You did. But, okay, we can cut that question.
Well, when it comes to different surgical facilities, one question I get asked a lot is, will we be doing the surgery at a hospital? And most of the time we do surgeries at surgery centers. And I think most patients may not know it off the bat, but a surgery center is where you want to have these procedures done. It's actually where, it's most routine, and you want things to be routine always with your surgery. And so these are almost all day surgery. Very rarely are we doing any overnight surgeries for patients. You do many overnight surgeries?
Very rarely.
And so they're almost all day surgeries where people come in and out the same day. And we work at several really great standing surgical facilities, outpatient surgical facilities. And the one where Brittany works at is MAO, which God bless me, I don't know what it stands for, other than being the communist dictator of China. What does it stand? Midwest American?
Mid-America
Orthopedic?
Orthopedics.
There we are. We don't do orthopedics.
No.
And we do most of the surgery
And
at
we do
MAO.
most of the
So
surgery
most
at
of the surgery at MAO is not orthopedic.
Maybe we
surgery.
should change the name to MAP.
I think so. And it's just a walk away from you guys.
Yeah. It's
Yeah.
right around the corner from us. It's great. It's very convenient. The staff there are all fantastic. It's an excellently run facility. And so that's what you're looking for. You're looking for things that are routine, accredited, where it's all day in and day out where these procedures are being done.
Yes, exactly. Some practical tips for listeners. We talked about must-have recovery items. We talked about household things. Your son is older. How old is he?
15.
15. So he's relatively self-sufficient. Are there any tips for, younger women with smaller children as far as recovering from this with small kids in the house? Any tips?
I would definitely have somebody there to take care of the little 100%.
Okay.
Because you can't pick him up, her at all.
Okay.
I mean, walking can be a task within like the first week. So, yeah, having support is probably a huge deal.
So for how long do you think?
Maybe like 2 weeks.
Okay. If you can have someone around.
Around, yeah.
Yeah. What do you typically tell patients, Dr. Steen?
I tell patients that it's like a C-section recovery.
Okay.
And so I've had a couple C-sections myself, and so I at least feel like I can relate to that a bit.
Yeah.
And so it's nice to have someone around for the first week or two with little kids, since you can't really lift up little kids super well. But to be, I think, really independent lifting up, a 3 or 4-year-old child, I think it's going to be about 6 weeks or so, like after a C-section recovery.
Yeah. So patients may ask, how long should my mom who's visiting take off, or how long should my husband take off? So it sounds like close to 2 weeks.
Yeah, I would say close to 2 weeks.
Yeah.
What do you say to people?
I say it's helpful. It's helpful to have someone around. Well, it all depends on if they have little ones at home that
Right.
really.
Yeah, if you don't have little kids at home, you don't need help for 2
Yeah.
weeks. If you are just taking care of yourself or taking care of some older children, really, I think having someone around for a day or two is fine.
I would say if they if they have little kids, it's helpful to get more, stools around the house, more kitchen helpers, more like things so they can be a little more independent. So you're not like holding them up at the sink so they can wash their hands.
Right.
That sort of stuff.
Yeah.
And then if they don't have kids, it's still helpful to have someone to, unload the dishwasher, do laundry. It's like the household things you just don't think about when you sign up for surgery like this. And that kind of stuff is helpful for that first week at least, if not 2.
It just kind of depends on how much, what you do at home and how much help you have around and what your lifestyle looks like. If you're one of those preppers and you've got weeks worth of food already in the freezer, then you're good to go. But if you got a couple little kids running around, you need a little bit of help.
Love it.
Yeah.
A lot of patients come in and they really fuss about implant volumes, and they'll say, I want this amount because my friend got that. Did you feel pressured at all like that, Brittany, when you were sort of thinking about this and picking implant sizes, or?
So I did have a friend who got implants, and she got a totally bigger size than I did. I got 355, moderate profile, and she got 4, I don't remember. They look the same as mine, but it's just so crazy how different implants look on different people.
Yes, thank you.
I mean, I've been in the OR and I'm like, wow, the 400 looks like that on that female, but if I put that in my body, it would look massive.
Yes.
So everyone is different.
Thank you.
Yeah.
Yes.
Implants are just a number.
That's a great perspective. Yes. Yeah. Because so much is very based on the width of the patient's chest and how much breast tissue they already have. And there's so many factors. So, yeah, good. Dr. Steen, how do you figure out if a patient's a good candidate for just liposuction versus they really need a full tummy tuck? Because some patients show up and they think they just need lipo and they really need one or the other.
That's a really excellent question, and I think that is a combination of the patient's goals and also comfort level and surgeon experience as well. I kind of joke, I ask patients to take a look in the mirror always and show them what they're looking for. And if patients do something like this, I say, it's the international sign for I want a tummy tuck. And that goes a long way, honestly. Like, it actually gives you a pretty good idea of what people are looking for. If people
so if they have something they can grab.
If people are putting their hands on their belly and grabbing it, this is tummy tuck territory. Because
They want it gone.
Yeah, because liposuction alone is not going to get rid of that hand grab, you know? And so I kind of think of liposuction as more being like a pinch, a little finger pinch, and a tummy tuck as being a hand grab.
Interesting.
Sort of in gross way of thinking.
No, that makes sense to me.
How do you think about it? That's my gestalt there.
Gosh, it's hard to describe. I mean, I like how you described it. I agree. If there's skin that you can tell is extra, and particularly after childbearing when there's stretch marks and that skin has been insulted, there's very few things that can replace a tummy tuck. There's some energy devices that can provide some very modest tissue tightening, but they're for pretty select patients. Mm-hmm. And so many women have the diastasis, so that's going to be treated better open with an incision anyway. So it's rare that patients don't need the full tummy tuck and that come for me.
Mm-hmm. And sometimes there are patients that are on the border where you're having a pretty long conversation about, we could do some liposuction here. You might have a touch of skin laxity afterwards. Maybe that doesn't bother you. Maybe you're better off having the short recovery and not having that big scar. Or maybe you want to go, all the way, and you don't mind having the scar, and you want to get the best look, best contour you possibly can with no little skin laxity afterwards. Then that's tummy tuck territory. And unfortunately, when it comes to body contouring, the more you do, the more you get, is really what it comes down to. You can try doing minimally invasive this or that or the other thing, but you're also going to get minimal results. And so the more you do, the more you get when it comes to body contouring. For
more is more.
More is more for this. Yeah, it is. Yeah.
It's funny to hear a Canadian say that.
Is that right?
Love it. Dr. Steen, are there any myths that you'd like to bust regarding mommy makeovers that you've heard?
That's a great question. What myths are there for mommy makeovers?
Or, you can separate them out. Augmentation, lift, myths.
I think one of the myths I hear all the time about breast augmentation is that you need to have your implants replaced every 10 years.
Oh, yes.
I do.
And have you heard that one before? Yeah. And so I would say that there are two reasons to have your implants replaced. One is some sort of medical reason. There's an implant rupture. There's a capsular contracture. There's something going on with the implant that's become a medical problem. And the other reason is some sort of cosmetic issue. They're now too big or too small, or you don't like the way they look in some way. But if you're not having any of those issues, then you don't need any surgery. And so some people will have implants in that are older than I am, and that's great. If you're not having any issues with them, then keep them. And so sometimes, it's best to keep a surgeon out of business, and that's totally fine.
If they're silicone, do they need to do anything?
It is important to monitor your implants. That is important. And so the current FDA recommendations, they changed a little while ago, but the current recommendation is to have a screening ultrasound 5 years after surgery, and then every other year after that. And the reason for that is that this technology is so good now that if they rupture, there's no way you or I would know. That's how good they are. And so you need a little ultrasound to kind of take a little peek on the inside and see if it's ruptured or not. And then you just kind of want to take them out on your own terms then. And at your leisure, or get them replaced rather at your leisure.
Brittany, is there anything you wish you had known beforehand, before all this?
I don't think so. I think I've done my research.
You could go back 6 months and you could talk to yourself.
I would have done it a lot sooner.
Really?
A lot sooner.
How sooner?
Like 10 years ago.
Okay. I do hear that a lot. Do you hear that, Kalila?
Oh, all the time.
The biggest regret.
Oh, yeah. Oh, yes.
You didn't do it sooner.
Yeah, people, unfortunately, there's a lot of stigma with plastic surgery, of course. A lot of movies and television shows that, make it sound like this is a crazy thing to do. When in reality, it's a lot of, normal ladies that just want to go back to what they, if you can call Brittany normal, I suppose.
Yeah.
That just want to go back to their pre-pregnancy self or to their pre-weight loss self and just kind of get a little bit of their lives back. And there's nothing wrong with that at all.
Yeah, I agree. And I'm excited because I think there is sort of a shift, hopefully within our society, as they're seeing more and more natural results from procedures. Facelift is a good example too, but breast and body, that, getting back to feeling normal should be normal.
It should be, especially now that in medicine as a whole, we've put the hands of control finally back into the hands of patients and out of surgeons. Like we've talked about, this entire conversation is about listening to patients, to their goals and expectations. And I think as a group of surgeons, we're now so much better than that. And I think that's really what's been driving the great results we've seen in the recent decades. That it's not the plastic surgery of the 1970s anymore. This is plastic surgery for the everyday woman now. Dr. Spaniol, do you have any myths you'd like to bust?
Oh, yeah.
Ooh, liposuction. If you do liposuction somewhere, that it's going to go somewhere else. And that's not the case. That if you do liposuction to a tummy, that the fat's going to find somewhere else to go, you know? Yeah.
Why do you think that exists as a myth?
I don't know. I think it's an older myth. I think it's mostly been debunked, but it's still one you hear every once in a while.
What plastic surgery procedure would you get done, Dr. Spaniol?
I really want my brows elevated.
Oh yeah, we were gonna do your
Yeah, we're gonna do some threads.
your threads for you.
Yeah. My eyebrows are starting to migrate below my orbital rims, which is an indication for a brow lift. A little bit. Just soft. Brow lifts in men are
exciting.
hard though, because it's hard to pick an incision, and yeah. Maybe we'll do
Botox?
threads. Well, Botox can do a little bit of a brow lift on the side by denervating or paralyzing some orbicularis muscle, but it's not going to be the central elevation that men really need. You know, women can have a little bit more peaked brow laterally, and that's
Looks funny in men.
aesthetic. Yeah, you get that Spock look on a man. It's not a good look.
Yeah.
Oh, okay.
Yeah. That, and I would love to get some little lipo of
chunk out.
my love handles. Yeah, I just grabbed it.
Yeah.
Maybe I need a tummy tuck.
Yeah.
Daddy makeover.
Yeah, daddy makeover. That should be the next episode. Daddy makeover.
Yeah, we can talk about etching.
Oh gosh. Speaking of natural.
Yeah. Gosh.
Like the fake abs.
Yeah. Have you ever done that?
No.
Yeah.
No, I'm not a fan of etching. I'm not a fan of etching. I mean, what etching is really is scarring. It's scar tissue, and that's not going to look natural. That is not what the body does to get abs. Not to mention, when the body moves, guess what doesn't move?
The etched fat.
That
scarring.
etched fat.
Yeah.
That's exactly right. And
Yeah.
so you can't flex those abs. They don't look like abs only in a still before and after photo. So. Not a good idea. Not to mention, if your weight fluctuates at all after the procedure,
Yeah.
it's gonna age real badly.
Yeah. It can look like you've got the Ninja Turtle t-shirt on your belly.
Yeah. Yeah.
Oh, gosh.
What's gonna be your next plastic surgery procedure? Have you been bitten by the bug?
I have. I don't know what I would want to do next. Maybe some lipo to my back.
Ooh, excellent choice. Excellent choice. I love doing back liposuction. Back liposuction I find to be very rewarding.
It's a great add-on too with the Mommy Makeover, like you mentioned.
Snatches that waist. It's a beautiful way of completing the figure, I find.
A phrase I heard is that a plastic surgeon said is that they look good coming and going if they get back.
Yes.
lipo.
It's true.
I love that.
It's true.
Yeah,
Yeah.
yeah.
Plus that back fat, that's just the last spot to go
It's
with
hard.
weight loss. Yeah, it's just really tough, and some people just doesn't want to go, and liposuction really is, I mean, the only way to do that. You can be in great shape and still just have a little bit of fat there that just needs to go with liposuction.
Yeah.
Agreed. All good points. Well, Brittany, thank you so much for joining us for this episode of The Aesthetic Angle.
Thank you for having me.
Dr. Steen, so glad to have you on
It's
for
my
your
pleasure.
inaugural voyage on the podcast.
Thank you to America's #1 plastic surgery podcast.
There we go. You said it.
Yes.
Heard it
North
here
America's
first.
#1 plastic surgery.
Ooh, Canada and Mexico. Here we
Canada,
come.
Mexico. Yeah.
To get a Spanish translation and I guess French, right?
We don't need to talk about that.
There we go. Thank you so much for joining us. Stay tuned.